DGL is interesting because GERD is not always just too much acid. Sometimes the problem is a damaged barrier that cannot tolerate normal physiology. DGL stands for deglycyrrhizinated licorice, or as many have said, darn good licorice. It is a licorice root with much of the glycyrrhizin removed. That matters because glycyrrhizin can contribute to problems like high blood pressure, fluid retention, and low potassium in some people. So DGL is used to preserve some of the gut soothing properties of licorice while reducing that specific risk. Most people use DGL for reflux, gastritis, type irritations, heartburn, or upper GI discomfort. But through the Praxis lens, DGL isn't an acid blocker. It's more of a mucosal-support conversation. GERD is often explained too simply. You have acid, suppress the acid, and done. And sometimes acid suppression is appropriate for the time being. But GERD can involve more than acid. Lower esophageal sphincter dysfunction, hiatal hernia, gastric emptying, meal timing, obesity, alcohol, caffeine, medications, stress, histamine, bile reflux, mucosal injury, and poor barrier resilience. DGL is interesting because it is commonly discussed around soothing the gastric and esophageal lining, supporting mucus production, and helping the tissue tolerate irritation. The loop may look like this. Reflux occurs, mucosa becomes irritated, sensitivity then increases, the person feels burning more easily, stress increases, digestion changes, more reflux symptoms occur. Then the person becomes dependent on symptom suppression without understanding the trigger. DGL teaches a better GERD lesson. The goal isn't always to eliminate a pathway. Acid has a job. Acid helps digestion. It helps protein breakdown. It helps mineral absorption. It helps microbial defense. So the question isn't always, how do we shut acid down forever? The better question is, why is reflux happening and can the mucosal barrier recover? DGL belongs in that conversation. Not as a cure, not as a replacement for medical evaluation, especially not if there are red flags like trouble swallowing, vomiting, blood in the stools, anemia, or persistent pain. But for the right person, DGL may support the barrier while the real reflux drivers are addressed. That is the Praxis lens, not symptom suppression alone. Barrier repair plus cause identification.